going to talk about. So today we are going to talk about important MCQs that can be asked in the topic myocardial infarction. It is a medicine topic. Okay, so the first thing is which is the ideal fibrinolytic which should be using, that is tenecteplase. It can be given as a single dose. It is given as a single bolus dose and it reduces medication errors. Okay, so while talking about fibrinolytics, as tenecteplase is a fibrinolytic, which are the contraindications to fibrinolytics? So the absolute contraindications are hemorrhagic stroke, if there is hypertension more than 180 by 110 at the time of presentation, if there is suspicion of aortic dissection, if there is any incidence of internal bleeding present. Okay, then the relative contraindications are use of anticoagulants if the INR is more than 2. These ones are relative. If there is history of prolonged CPR, there is a known bleeding disorder, there is pregnancy, there is peptic ulcer, there is severe hypertension. So these ones are the relative contraindications. Okay, so then comes percutaneous coronary intervention. So when it is done, so the high risk criteria are new ST segment depression, along with if there is history of diabetes mellitus, the GFR is less than 60, the ejection fraction is less than 40%. If there is post-infarction angina, if there is a history of PCI within 6 months, if there is prior CABG, refractory angina, congestive heart failure, if there is a recurrent angina at rest. Okay, so acute coronary syndrome then next comes. So what acute coronary syndrome includes is unstable angina and STEMI. Okay, so what is the treatment protocol? So first is ABC, that is airway, breathing and circulation. Then we need to supplement oxygen to the patient. Then aspirin is given as a 325 mg dose. Then we go for biomarkers, cardiac biomarkers such as troponins. Then we go for nitroglycerin tablets, which are each tablet is given 5 minutes apart. Then if we find any symptoms of congestive heart failure present, we go for loop diuretics. We start beta blockers at low dose. Morphine is given for pain. And finally, then we go for reperfusion with percutaneous intervention. The next thing is, this is one of the MCQs which is asked frequently, that is swinging heart sign. Swinging heart sign is seen in myocardial rupture, which is one of the complications of myocardial infarction, seen 3 to 5 days post MI. It is most commonly present in older women, and it involves the anterior wall of heart most commonly. So what we should know, absolutely know, so there is no excuse for not knowing it, is contraindication, which are the absolute, which are relative, and when is PCI done. Okay, so what is treatment protocol for acute coronary syndrome? That's it. So these are the MCQs which can be asked in management of myocardial infarction. Thank you.